Good evening, students. Today we are going to deal with a new chapter in the same subject, that is pathology. And here we will study about the chapter named as body cavity fluid, transudates and exudates. So here we will study about the fluid imbalance like metabolic things or electrolyte imbalance, metabolites imbalance, and the body cavity tests like cerebrospinal fluid analysis, etc. And this chapter is the second chapter of clinical pathology. The first chapter which I taught you was the very important chapter. In this also these are very important chapters. So let us see what is consisting in this chapter. Firstly, what is cerebrospinal fluid? This chapter, the very long essay type can come in exam about the cerebrospinal fluid analysis. It's very important chapter. So let's see. Cerebrospinal fluid is a clear and colorless fluid formed primarily in ventricular choroid plexus. So it is formed primarily in the ventricular choroid plexus by combination of both active process and ultracentrifugation. So here we have studied about the centrifugation, and that the same is ultracentrifugation, where a pseudo force is operating. So one is centrifugal and one is centrifugal. So it is the combination of active process as well as ultracentrifugation. Second is reabsorption of CSF, that is cerebrospinal fluid. There occurs the reabsorption. Again the absorption will occur at the arachnoid villi. It is a part of body which is projected in the venous sinuses in the dura mater. In the dura mater of the brain, since it is a cerebrospinal fluid which is mostly found in the brain, inside of brain, so in the venous sinuses of dura mater, arachnoid villi are present. At that side, the reabsorption of cerebrospinal fluid occurs. A total volume of CSF is 90 to 150 ml in adult and 10 to 60 ml in neonate. We can see that the total volume needed for the cerebrospinal fluid analysis or cerebrospinal fluid, normal volume is 90 to 150 ml in adult and 10 to 60 ml in neonates. Normally up to 2 ml of CSF is withdrawn. Specimen should be transported to the laboratory. For cerebrospinal fluid analysis, normally 2 ml of cerebrospinal fluid is withdrawn from the specimen, taken from the specimen, and it should be supported or transported to the laboratory immediately. As soon as that fluid is taken in the form of a specimen, it is transported immediately and should be processed and checked within 1 hour. Otherwise, cellular degradation occurs, giving false negative results. Otherwise, the cells present in the cerebrospinal fluid may be having false negative results. Then, gross examination. What is gross examination? These are done directly without the microscope. Gross examinations are the examinations which are done without the microscope. So let's see what is gross examination. In gross examination, mostly we see the color, texture, all the physical things we see. And in microscopic examination, we see the inner structures. So the color, will see color about the CSF. Normally the CSF is a colorless, clear colorless like distilled water and does not have clots. It does not have clots also, it is colorless. Color of CSF is examined by holding the CSF tube beside the distilled water tube against the clean white paper. So how the color of CSF can be examined? It can be examined by holding that tube, CSF tube, beside the distilled water tube, and there a clean white paper should be spreaded. If pale yellow or pink color is noted, then the centrifuge the sample at high speed, then the sample will collect or centrifugate at one time at a high speed at one place with a high speed of 5 minutes, and then examine the supernatal visually. The thing which is plotted, you can examine that. Following alternation in CSF color may be observed due to following reason. When that color is observed in the tube against the white paper cap, so what are the color differentiation which can observe related to the disease or disorders are? First one is yellow color, xanthochromia, may be due to following subarachnoid bleeding, means in the subarachnoid space where the blood villi are damaged inside and they will come out through that space, so it will cause the subarachnoid bedding, capillary bedding. Bedding means it will have a contour. Then severely jaundiced, person may have jaundice. Then high protein level more than 150 gram mg per dl. Examination error also can occur, such as delay in examination and sample contamination with detergent. So these are the things which may impart yellow color to the solution. Then second is orange color. Orange color, sorry, that's not a solution, that's a liquid. Then orange color is having the disease dietary hypercarotinemia, means there is increased amount of carotene in our blood due to taking diet of high carotene levels. So it may impart orange color in the CSF. Brown color is due to meningeal metastatic melanoma, means brown color shown may be indicated and it may give indication of the disease meningeal metastatic melanoma. Melanoma here mainly the melanocytes of the skin. Then red to orange color. Red to orange color, the patient on rifampicin therapy. Rifampicin therapy is a type of antibacterial medicine used for the TB, means in treatment of tuberculosis, rifampicin is used as a drug. So in this, the red to orange color can be observed. And if this clot is having pink color, it turns to red, then it may indicate that the presence of blood is there in the cerebrospinal fluid sample. The normal pH of CSF is 7.28 to 7.32, which may be checked using pH paper. The lactic acid pH paper, which is used for checking the acidity and basicity, can be used for checking the pH of CSF. Now moving next is the appearance. This is also the exactly cross examination appearance. Generally, the appearance of CSF is a crystal clear without presence of any clot. There is no presence of any clot. And following alteration in appearance may be observed. There are the following alternations which may be observed. These are turbid or cloudiness, means increased cell or bacterial counts in the CSF. Then smoky or opalescence, means less red blood cells, RBC, and white blood cells in the CSF will be there. These are the color which may impart the following things. Then second is a microbial examination, means here we will see through the inside, microscopic examination will there. Normally during microscopic examination, which is not visible through naked eyes, microscopic examination of CSF, no RBC is seen only lymphocytes between 0.8 cells per microliter is seen, and the smear, that is the solution is having of CSF, is also having smear, means a part or a piece of CSF also may be stained for bacterial and Gell-Nielsen stain for acid fast bacilli examination. It is a Gell-Nielsen stain is a acid fast bacilli examination, is a type of test performed to check the presence of bacteria, acid fast bacilli. So CSF can be used there also. The CSF can also be cultured from bacteria, tuberculosis and fungus infection. Through fungus infection, tuberculosis and bacteria, the CSF can be grown. Conditions involving neutrophils in CSF. What are the conditions which involve the neutrophil in the CSF? These are bacterial meningitis, means these are the disease which have, and due to the infection, these are bacterial meningitis. Brain abscess, these are due to infection. Then brain infarct, this is stroke, a type of stroke due to blood vascular abnormalities. Then repeated lumbar puncture. Condition causing lymphocytes in CSF will be viral meningitis, tuberculosis meningitis, parasitic meningitis, and the condition causing plasma cells in CSF are multiple myeloma, tuberculosis, meningitis, meningoencephalitis, and the condition causing lymphocyte or monocyte in CSF are viral meningitis, tuberculous meningitis, fungal meningitis, and the condition causing malignant cell in the CSF are the leukemia, lymphoma, and metastatic tumor. So here we will end. The next topic I will